Hello, everybody. This is Dr. Michael Richman, and this is our podcast today. And I'm very excited on a special guest who I have known since she was in college, and now she is pediatrician extraordinaire in Los Angeles, Lauren Meepos. And Lauren went to medical school at Tufts University, and she did her residency at Children's Hospital LA, which I'm partial to since I spent 6 years of my life there. I think it's the best. And now she practices in Los Angeles, and she is on the board of the Los Angeles Pediatric Society. So with that said, welcome and happy for you to be on the show.
Thank you so much, Michael. Happy to be here.
So my first question, I'm laughing because Lauren, when she was in college, I was like, "Are you sure you want to be a doctor? Are you sure?" And she was like, all gung ho. So good decision, bad decision?
Ultimately, good decision.
Right.
Of course, there are a lot of obstacles in medicine these days, but for me, the best decision, and I
Right.
wouldn't do anything else.
I mean, you don't realize, like we talked about, you don't realize what you're getting yourself into until you
No,
get yourself into it, you know?
right. No, the part that I love, that I'd say almost all of us love, is taking care of patients, and that does take up a good portion of the time. But then, of course, there's all the dealing with insurance and paperwork, which is not what
Right.
I'm into it for. But the
And
care outweighs it still, for me, at least.
and being a pediatrician today, especially, is, I think it's so difficult because not only do you have to be a doctor, but you have to be a psychologist and a psychiatrist and a social worker, and you have to deal with so many issues, and it makes your job so hard,
Yeah,
And
I agree. I feel like I wear many hats these days.
right, exactly. So my first question to you is, how do you think you impact families and children the most? What do you do that you would say defines you differently than any other medical specialty?
I think the thing that is from the start with pediatrics that's so different is it's from the moment they're born. It's preventative care. You have a patient from birth until they become an adult. So at its core, it's about preventing disease. And the biggest thing that we do that's much more prevalent in pediatrics than in other specialties is vaccines. And that, I think, is the most important thing that we can do, because we are prolonging all of these kids' lives with all of these diseases that we are protecting them from. So many things that 50 years ago, 100 years ago, hundreds of thousands of children would be dying from today, they're all alive because of these vaccines.
Right. And obviously we're going to get into, deep dive into it, but I don't think people understand, like, all you have to do is go to Boston, how in the cemetery is in the middle of the city, and you can walk around right in the middle of between two buildings, and you look at the tombstones, and it's like 8 years old, 10 years old, 12 years old, that, like, people back then lived to 51. That was considered a long life. So today, when people are getting into, like, the whole vaccine thing and everything, it's like, guys, most people died of diseases that today we don't see. Like, I posted on my Substack, it's interesting, a picture of somebody in an iron lung. And I said, when's the last time you saw somebody in an iron lung? And then, I answered, I said, probably never, because vaccines work. And 35,000 people viewed it and commented on it, and people don't realize, like you said, most of the diseases that we're vaccinating for now, people died from
They do.
back then,
They
you
do.
know?
Yeah, and I think that's something that makes it a little bit harder for parents these days. You, a lot of people that are having children for the first time, or even have kids that are in high school area, they never saw these diseases. So it's almost like an out of sight, out of mind situation.
Right.
Like, I've never seen a case of polio. I've never seen a case of tetanus. Like, these are things that we don't commonly
Right.
see because vaccines work. And so I think that the, like, strong pull that people used to feel to kind of protect themselves for them, they don't have that as much these days because they don't see the harm that all these diseases cause.
Exactly. And I mean, the perfect example was I remember a kid who I went to Buckley with in sixth grade, and that was before Cedars was Cedars-Sinai, and he lived, but he was dying in the ICU at Cedars of Lebanon of meningitis,
Mm-hmm.
which is wicked.
Yeah.
And kids were dying of it. And now with the vaccination, yes, there are cases of meningitis. It's not like we don't see them, but there were a lot of kids dying and sick as can be before. So okay, so here's my question. So now that the ACIP, and for everybody, that's the Advisory Committee of Immunization Practices. So basically, it's the government, and they make the decisions. Even though it's an advisory committee, it's basically the mandate committee on what should be given and what shouldn't. So RFK gutted it from 17 people to now I think there's 8 or 9. Um, you can be politically correct. I don't have to anymore, but probably 5 of them are incompetent and have no experience being on it. And in fact, the one of the women who they put on is a former nurse who's head of the largest anti-vax society. Um, and she's running the safety committee for vaccines, which is like putting El Chapo in charge of the DEA. I mean, it's utter insanity. So what are you going to do now as a pediatrician? Who's your go-to? What's your go-to now that Paul Offit's gone?
Yeah, I mean, it's a stressful time for us because that is what we used to use for our recommendations every season. They'd come up, they'd meet, and these were the leading experts in the field. These weren't people that were having conflicts of interest. These were the experts in vaccinations, in infectious diseases. So they were the ones we could trust. And so now it's not the same type of committee. They did not have all the discussions that they were planning to, and so we are not going to be necessarily looking to them anymore. The American Academy of Pediatrics, which is the AAP, that is our overarching kind of body for pediatric medicine. That's our national society. And we decided that's not how we're going to be making our recommendations. AAP is going to be putting out their own recommendations going forward. So that's where we will be looking for towards to kind of change our current guidelines with the new vaccines that are coming out, things that are more yearly like flu, and like there's a new meningitis vaccine that came out. So things like that. But
You don't think though that that's gonna so since there's obviously going to be a conflict now with the ACIP and what the ACIP does determines who pays for it. And obviously, we talked about so today is a monumental day in a bad way because in the midst of an affordability crisis in the United States, we have gutted affordable health care.
yeah,
And the majority of people who are on um, Medicaid, or in California, it's Medi-Cal, are pediatric patients and the elderly. So the question is going to be if the current ACIP doesn't want it or doesn't recommend it, are people going to be able to get access to the vaccines? And the answer to me on that is, I don't know.
and
I don't know what's going to happen.
I don't know either. It's a scary and stressful time in regards to that because yes, the insurance companies look to the recommendations to decide what they are going to cover and what they're not going to cover. And so, for a lot of patients, particularly ones that are on Medicaid, they rely on what insurance will cover for their vaccines. It's
Right.
a lot of people that can't afford to just pay out of pocket for a vaccine. Without insurance, vaccines are expensive, and so there is I anticipate there are probably going to be less kids getting vaccinated and things that are very important and could be saving lives. And I'm hoping that's not the case. I'm hoping the insurance companies to continue to cover everything. But it's just a wait and
And
see.
when we say everybody, when we say insurance companies, we're also referring to, Medicaid, because, just the global,
Right, right.
it's just not necessarily because, at Children's Hospital LA, which is phenomenal. I mean, it's next level care, but the majority of the kids there are on Medicaid, on Medi-Cal.
Right, which
And
is the public healthcare. So it's still an insurance, but just like the governmental one. But and that covers a lot of children, more children than anyone
right.
else. And so that, and what's really nice about that is kids on Medicaid have been able to get vaccines for free.
Hmm.
And it's so important. So I don't know what's going to happen.
I mean, I saw today that 1.7 million people in California um, will lose their health care, who are on, and like we said, it predominantly affects um, pediatrics, and it's really concerning because um, so much of the misinformation that is promulgated on the internet and by Kennedy um, is just insanity. I mean, we can start out before we talk about specific vaccines, but explain to everybody that there has never been one single study ever that has shown that thimerosal, which, with the exception of being in a couple flu vaccines now, is not in any vaccine, never caused autism.
No,
Never,
never
right?
caused autism. It never did. There was data back in the 90s, and it wasn't even a study. It was preliminary data that showed, could there be an association? They hadn't even run the study yet. It was presented at a conference. It was preliminary, and then they actually did the study, and it showed no correlation, no connection whatsoever. No other study has ever been able to show that. But just even with that concern, which there is still no evidence and there never has been, it's been removed since it's either 2000 or 2001 from all of the vaccines that kids under 4 receive. There are just a couple flu vaccines that have it, and nothing else gets it. So
Right,
they had mentioned hepatitis B. It is not in the hepatitis B vaccine.
right,
It is not in the MMR vaccine, the polio vaccine, the tetanus, the whooping cough. None of these vaccines contain it. And
right. And what people
also,
don't understand is it's not like mercury, like, people think of a thermometer. It's the compound has a mercury molecule. For everybody, remember the periodic table of the elements. Mercury was one of them, connected to it, just like water's H2O. It's
mhm.
it's two hydrogens and an oxygen is water. So they've made people believe, like, oh my God, they're putting pure mercury in your body, and it's not. And so with that, we got the vaccine. Let's get into the autism thing, because that seems to be like the big concern with vaccines, is autism. And like we had talked about, um autism is a spectrum, and the only reason that today it's the hot topic everywhere is because we're looking for it, and because the testing is much improved. So back when I was growing up, and obviously I'm older than you, um, my friends who were on the spectrum now, who are on the spectrum, back then it was sit your ass down, study, take a no dose, drink a lot of Coca-Cola, that has caffeine in it, and they got their shit done. And now it's everybody and their brother and mother is on the spectrum. So we talk about autism and explain to everybody what autism is, really, so they understand.
Yeah, so autism is it's a vast entity. It is a neuro it's a neurological disorder that affects people kind of starting in like early toddlerhood. And it's a spectrum. So it can be anywhere from very mild to much more severe, where it can just be kind of some mild social functioning to, on the other side, people that are nonverbal, can't function well in everyday society. But it is not one thing. And we are still learning so much more and more about it every day. There are definitely a lot of genetic components, there are environmental as well, but you can't, it's not one thing. And so that's the other part of it. It's very vast. We used to have multiple names for it. There was autism and Asperger's, which was considered the milder form. And now we just have one big spectrum. So that alone brings more people into it, because more people that diagnosis, because we've kind of changed the definition of what is autism. And also, as you were saying before, the screening is key to diagnosis, and we become much more aware of it. Pediatricians, we screen for it at our checkups, and we become so much better at it. So we're picking it up way more than we used to. And what's important about that too is, what we do know is when we pick it up early and we get kids into services early, outcomes are so much better. And so we care about finding it. And so that's kind of the big reason why it's talked about more. There's more known about it. We're screening it, we're picking it up. The
And
other
those are like early, we're talking about like behavioral interventions, correct?
Exactly, yes. Behavioral interventions where they meet with different kind of therapists and work on speech. They work on kind of spatial motor type skills. They work on social functioning, and that starting that earlier kind of improves the overall long-term outcomes. So we're picking it up better and we're treating it better, but we also, there's a lot of people that are self-diagnosing as well. So it's become such a hot topic. Social media puts things all over the place, and a lot of people are now self-diagnosing with autism, or getting a diagnosis that didn't go through the proper kind of
Right.
channels and screening process. And so, yes, there
A
are.
lot of those AI models, like in regular medicine, I have people who are calling me like who are self-diagnosed through AI, and it's like,
Mhm.
no, you don't have biliary duct cancer. Okay, I can promise you, you don't have biliary. Well, AI says, and I notice a little yellowish hue, but other than that, I feel it's like, no, you're good, you're good. And
Yeah.
I think that like Rain Man, you remember the movie Rain Man. He had Asperger's, supposedly, and people, they don't understand that it's like it's a spectrum sort, and it's been around. It's been around prior to vaccines, and that's what they don't want to admit.
Oh,
It,
yeah,
if you don't look, what people in medicine is, if you don't look for it, you're not going to find it.
exactly.
Okay, so we didn't look for it because we didn't know about it. But I I mean, this is an opinion, correct me, but do you think really it's more prevalent today than it was back then? My answer is no, but we're just looking for it, so we're finding it.
Exactly, and I agree with you completely. Like, yes, there are more people that have the diagnosis today, but the main reason for that is because we are screening and diagnosing. We are picking it up. There are plenty of people that had it before, but we were not finding these people because we were not looking. We were not looking, we didn't know how to look, and so our knowledge today is so much greater than it used to be.
Right. Um, yeah, I mean, it's interesting. It's almost like I feel today a lot of parents want to use like that my kids on the spectrum as a crutch to why they're doing badly in school or why they're having trouble interacting socially with their friends. And it's like, rather than just being like, okay, why do we have to put a diagnosis on everybody? How about the reason they're doing badly in schools because they don't study, or because they don't get along with their friends, because they're the wrong friends. Do you know what I mean? Like, I'm sure you see that. It's like, no, my kid is on the spectrum. Trust me. And it's like, it's never even been tested. There's like, you're just self-diagnosing. There you go. Right? I mean,
I mean,
don't you see a lot of that?
not not really. I would say that
Okay, I stand
my
corrected.
my patients that their parents are telling me that the kid has autism are ones that have that diagnosis, and
Okay.
it is true in people, in especially in kids on the spectrum, there often is a lot harder social functioning and school performance and things like that, but you need to go through a proper
Right.
evaluation to see if that really is what's going on. And there's also, and it is a spectrum. So there can be people that have
Right.
autism where it's very, very mild and they still do well socially and they still do very well in school. So it's not, it's, there's, there's a big, it's spectrum. It's a big spectrum of what you see.
Right.
The
I mean,
other,
I guess what I'm saying is I know people whose kids, because they've had them tested, like, who do not have, who are not on the spectrum, but they were using it. They never were tested, and they were using it as their explanation why their kids were having so many problems functioning. And then they're tested, and they don't believe the diagnosis. The testing is inaccurate, or I don't believe it because my kid. And it's like, listen, nothing's perfect, but there are a multitude of reasons. Just like there's the causation, we've never established the causation um, of autism. There's associations, just like you said, environmental, genetics, X, Y, and Z. But, I want you to confidently say today and let everybody know there is no evidence in the literature whatsoever in any human trial that vaccination causes autism, correct?
that's 100% correct. There has never been any truth to that. There was a doctor who he has lost all his credibility. He came out with one study decades and decades ago that said there was a link between MMR and autism. He fudged the data. There was no truth to this. And that came out, and he suffered that he lost his medical license. And no study has ever been able to reproduce
Mm-hmm.
it because it wasn't true. And that's the other thing about medicine, and just science in general. Things are supposed to be reproducible. And
Mm-hmm.
so if something cannot be reproduced, that should also make you perk up a little bit and think there's something fishy here.
Right. I mean, that's one of my things when I explain to people or I write a paper. If they see something on the internet, on social media, that says a study shows, but the person never quotes the study,
Mm-hmm.
and um or the author, to me it doesn't exist. I mean, we already know that Kennedy, in his Maha presentation or whatever from 2 weeks ago, that three of the papers that they cited weren't papers. AI made them up. They're they're
Yes,
they're,
yes,
they're
there.
fake papers. I mean,
Yes.
it's incredible. So so vaccines, are safe. I absolutely agree with you, on that. And I want to talk specifically now with the COVID vaccine.
Mm-hmm.
I know that a lot of pediatric practices are they won't see patients who are vaccine hesitant or who are anti-vaxxers. And I understand that, personally, I understand because I think that especially as a pediatrician, um, you're an advocate for a child and who is incapable of making their own decisions because number one, developmentally, their brain, kids, teenagers, their brains don't work, just poor choices. But also legally, they're not. So the women, the parents, um, or what the parents feel may not be in accordance with what guidelines are or what the thing has to do. So, I mean, forgetting about even what's in the best interest of the kid, but medically, legally, it's a really difficult situation. So I understand why a lot of practices are, we can't deal with this. So, I mean, are you seeing a lot of practices around the country that will not see patients who are anti-vaxxers?
Yes, yeah, and it depends kind of where you are in the country too, and kind of what the beliefs are in that area more. But yeah, there are plenty of practices that require vaccines. I don't think it's that common to have practices that require the COVID vaccine these days. But kind of requiring like kind of the general childhood vaccines,
Right,
yes.
right,
But COVID's a little bit of a different story these days, and there have been a lot of more concerns from families about it, and understandably so. And I think kind of everything through COVID and the COVID vaccine, and it was the beginning of this new era of vaccine hesitancy that we're in. And I understand where people are coming from with that. It was a scary time. It was a scary time. People were very sick. People were dying. We knew very little. And so we were going with what we had. We came out with a vaccine. And I mean, I'd say at the time, most people were very happy for it. I know
right,
the moment I could get it, I rushed out to get it. Um, and it was our only protection, and for something that was very serious and deadly. Um, and years have gone by since then, and it is not the same COVID now that it was back then.
right, right. I mean, we were having 3 to 5,000 people die a day. I mean, there were over 1 million people that died in the United States, and I think worldwide 19 million. And I know doctors who died. I have friends who died who were completely healthy. So it was a totally different disease. And what people don't understand is, I wrote an article about it, and it was, would you get an mRNA cancer vaccine? Okay, because that's what the cancer vaccines that they're working on. And I have like MAGA friends who are like, absolutely. And I'm like, dude, there's no difference between COVID. I go, this isn't like this just came out. This has been around for now, I think I want to say 21 or 22 years.
And that's
mRNA technology.
not new.
Right. It's not like they just sat around and they're like, hey, we're going to do this is new and we're going to insert something in your DNA. So, in discussing this, let's take, certain age groups. Who needs to be vaccinated, and when do you first vaccinate a baby? And through what age do you think it's absolutely necessary for kids to be vaccinated?
For the COVID vaccine, you mean?
Yes, first.
Yeah. So I think the recommendations now are not the same as they were before. Before, when it was a new disease that was much deadlier, we were recommending for everyone to be vaccinated. Um, Now, 5 years after the pandemic started, most people, unless they're very little and weren't there in the brunt of the pandemic and kind of born after that, most people at this point have either had COVID and have had some natural immunity from having the disease, or were vaccinated years ago. And
Mhm.
so we're in a different place these days. What we know at this point is certain populations are still at higher risk for severe forms of COVID. Elderly people, so still always the recommendation for elderly to get vaccinated. People with certain underlying conditions, ones that are immunocompromised, certain lung, heart, diabetes. For kids with significant asthma. But the other group is young children under the age of 5. They still tend to get much more severe forms of COVID than the general population. And so for those children under 5 that have not had COVID, we still are recommending the COVID vaccine. Just that we know that getting an initial primary series is really helpful and very protective against getting severe forms of COVID that's going to end you up in the hospital.
And that's the usual 2 shots.
Yeah,
Um,
two or three, depending on which
right.
vaccine you're getting.
Explain to people why. I know the answer, but explain to people why it's 5 years of age. Why 5 and below are they more susceptible to severe COVID?
Yeah, I mean, it's the same reason that kids under 5 are more susceptible to severe cases of basically all respiratory
Right.
viruses, their lungs have not finished forming. When they're born, they have a long way to go still, but even
Right.
until age 5, those kind of the terminal parts of the all of the little vasculature is still growing. And so even a 4-year-old hasn't fully developed their lungs, and so COVID is a respiratory illness, and so the chance of getting either like a really bad pneumonia or something that we see commonly in young kids is something called bronchiolitis is much greater. So
Hmm.
we see it for COVID, we see it with influenza, with the flu, we see it with RSV, and even just regular cold viruses. They hit little kids a lot harder.
Right. And little kids are, which people don't. Yes, you're in private practice now and you're not at Children's Hospital LA, but I mean, if you go to CHOP, Children's Hospital of Orange County, or Children's Hospital of LA, there are kids on ventilators um, from COVID
Yeah.
or from the flu who weren't vaccinated, parents who do die, or who are sick as can be. So,
Mhm.
people, just because it's not talked about today, there are still plenty of people in the United States who are not vaccinated who are dying,
Yeah.
right?
Yeah. Every
So,
people are still dying, and kids are still at risk. And so COVID's one. The other one that was for a pediatrician, the scariest thing for a little kid for is RSV. And so that is something that we actually finally came out with an immunization for. And it's technically for the children. It's not a vaccine, it's an immunization. So preformed antibodies to the virus. And because RSV is this one particular virus that in young children that would be throughout my residency training and in depending on the year that I've been in private practice, we would have so many kids in the hospital, whether they were just on the regular floor or in the ICU with this virus. It causes severe lung problems. So that was game changing for them to come out with this. And so just another example of these young children, they have a really hard time with these respiratory viruses.
when did RSV come out? I forgot when the vaccine actually came out, when they had something. How long ago was that?
Fairly certain it was last year, not the year before.
Right.
Yeah. So it was either last year or the year prior, but it's newer and it has been making such a difference. Like a handful of years ago we had a very bad RSV season, and it felt like every other day we had one of the patients from our practice hospitalized with it. And they had treatment before, but only for very high risk babies that were born prematurely, had lung problems, heart problems, things like that. So now there's something that's available for all infants under the age of 8 months in kind of going into RSV season, and high risk infants and young toddlers until about a year and a half old.
And then after that, do they continue vaccination?
Nope. After that point, they don't continue to give it because you're out of that high risk period. And so it's really one that is targeted for the patients that are at highest risk of severe disease, of poor outcomes. And yes, a kid that's a bit older, a 3-year-old
Hmm.
RSV, it is not fun. They are going to be up coughing for days, no
Right.
sleeping. It's still
I
not
mean, I remember that cough, but what I think
fun.
is it's remarkable, even, like, I mean, I'm boarded in general surgery and cardiothoracic surgery, lung and stuff. Um, and when, probably in the last couple of years, Dr. Selby, who I talked about in the last podcast, is the head of hepatobiliary and liver transplant at USC, who started, he was one of the original guys from Pittsburgh. We were both like, older people can get RSV. I thought it was just babies, and the truth is, like, nobody ever talked about it in adults,
Yeah,
and elderly, and
good deal.
and it's legit. Now it's like, if you're elderly or you have respiratory problems, you also need to be vaccinated for RSV,
Mhm.
during season. But okay, so getting back to COVID, So the, as we know, we both watched, I sent you the video of some of the new guidelines and some of the new labeling recommendations that the CDC has made. And for males 12 or 15 to 20, it was like 27, the incidence of myocarditis, I don't think it's particularly high. It's 27 cases in a million per million vaccines. And for everybody, myocarditis is an inflammation of the heart. Yes, have we done heart transplants on people who have viral myocarditis? Yes, it's not that myocarditis is not a death sentence in any, and I think they're taking this turn that is, again, a spectrum. People are a little sick and then people are a lot. But do you feel strongly that kids who are maybe boys who are completely healthy between 15 and 25 or whatever need to be vaccinated at COVID? Or on that, are you kind of like,
No, so yeah, after outside of the kind of 0 to 5 range, it really is a conversation with each family. Um, so I don't feel strongly that a 15-year-old, otherwise healthy male needs to get a COVID vaccine. Um, Most likely he's either already had COVID or already had the vaccine. And
right?
so the vast majority of them will already have immunity of some sort. And so really it's, do they need a booster now? And the answer is probably not, unless they have certain underlying conditions that make them high risk for severe disease. And for most children are healthy. So most children don't have underlying conditions that make them at higher risk for severe COVID.
But I mean, what I don't get is, other than the myocarditis signal in that age group, and I think there is enough data. I think the original data came out of Israel. I think there is enough data to say that there's an increased signal for myocarditis in that age group. But other than that, like, I personally don't see any downside. I mean, but I think it was so much of either mishandling of the information, because it wasn't misinformation. I think
Mm.
people were led to believe initially with the vaccine that they would not get COVID. And with a lot of vaccines, don't you agree? Like, it's
Yes.
people think, if I'm vaccinated against this, there's no way I'm going to get it. And nobody ever from the top down said that. They said, if you get it, just like the flu vaccine, it's not going to keep you from getting it. Hopefully it's not going to be as severe.
Yeah, and I think that's a really common misconception with vaccines in general. And I will say for the COVID vaccine, when it first came out, we didn't know yet. We didn't know, is this going to be a vaccine that prevents people from getting it, or is this going to be a vaccine that's going to just make it less severe, reduce your risk of having severe disease? And what we've seen with time is it's going to greatly reduce the risk of severe disease. And that also is the case for the flu vaccine.
Mhm.
And for other vaccines, I would say the vast majority of our childhood vaccines, they actually are making it extremely rare that you will get the disease that we're vaccinating for.
Right. I mean, I just got a call recently from a friend's daughter who just had a baby. I think the baby now is 3 months old. And she asked me about rotavirus. Should she get her kid vaccinated for rotavirus? And she's like, well, you and my mom weren't. And I'm like, because there wasn't a vaccine.
Yeah.
Um, and that's what people don't understand. It's like,
Mhm.
okay, we would have if there was a vaccine.
Yep.
Rotavirus is like wicked. It's
Yeah.
it's diarrhea where, like, in non-developed countries, people die. Lots
Yep.
of kids die.
It is one of the leading causes of hospitalization for young children across the world. It causes really severe vomiting and diarrhea, and as a result, very bad dehydration, which can be fatal. And so that is why we vaccinate for it. And so I recommend it for all the
Right.
patients. And that's the other thing with all of these younger childhood vaccines, we're giving them at a time that the kids are most susceptible to be getting very sick, very ill from these diseases. So we're protecting them when they're most vulnerable.
Okay. Next question. This, because I don't know about it, and
Mm-hmm.
I'm curious. What age for hepatitis B, and why so early for hepatitis B?
Yeah.
Because I don't know if when you started med school, I know the vaccine started right. They became available when I started my I think right before my residency at USC, and it was like, thank God, and that's when AIDS was first, and it was like, okay, like at least I'm not gonna get hepatitis B and get liver cancer and die from that. AIDS possibility, needle stick. So why now hepatitis B so young, and how are they at risk if um if they're not using needles and they're not through sexual activity, which is the common cause of it?
Yeah. So the reason, there are 3 doses generally that are given of the hepatitis B vaccine, and the first one is recommended right after birth, like while you're in the hospital. And I completely understand why parents have reservations about that. They have a brand new baby, and it can feel like a lot to them. And getting a vaccine isn't easy to kind of sit through. Your child is going to cry. You have a new baby. You, as a parent, your job is to protect them, and you also have a hard time sitting there and watching kind of your child go through something that you know is painful for them. So I completely understand where parents come from when they're concerned about doing it right then. The reason for it is, so hepatitis B used to be something that was so prevalent, and it was so problematic. So when hepatitis B, which causes hepatitis, so inflammation of the liver, it can go on to full on cirrhosis, liver failure. People die from this when you
And
get,
liver cancer.
and liver cancer as well. But when you get it as an infant, as a young infant, the outcomes are very, very poor. So kind of when you get it also plays a big role. And the whole part for infants, if mothers have hepatitis B, um,
That's my question.
yep,
If a mother has hepatitis B,
yep, there's
what is the incidence of the baby being born with hepatitis B?
I don't know the exact numbers, but it's high. It's something around like 50%. I believe. I'd have to double check that, but it's a high incidence. And so that is the reason why they decided to start giving the hepatitis B vaccine right after birth. So around the world, there aren't as good as screenings as there are now. There used to be that's so going from the disease being transferred from the mother
Mhm.
to the infant, something that's called vertical transmission. It was something that was very, very common, and it is not something that we see as often anymore because of vaccination, but also because of screening. So moms get screened during pregnancy, or they should be, but the fact is, not all parents not all mothers are getting that screening done. And so, as a public health measure, to guarantee, in a sense, that the baby is protected, that's the reason why. And even if you did screen negative during pregnancy, there's still
Mhm.
a chance of getting hepatitis B after that point that you had screened. Um,
But the mother's hepatitis B,
mhm.
um, and the baby comes out, is the baby gonna, is there a chance the baby's not gonna have active hepatitis and just already have antibodies? Or is so I guess my question is, if the mother has hepatitis B and the kid comes out and has hepatitis B, how is the vaccine gonna help? Because the reason why we're vaccinated, let's say in our age group, or when remember, it was mandatory, like you're not going into the hospital, you're not, going to medical school, you're not doing residency unless you're vaccinated for hepatitis B. It was to keep you from getting hepatitis B.
Yeah.
But if the kids haven't now, what does the vaccine do?
So in mothers that we actually know have hepatitis B, and that does still happen. It's most commonly we see in parents that have come over from abroad. A lot of people used to get it from blood transfusions many, many, many years ago, decades ago, before they were routinely screening. And if the mother has hepatitis B, known hepatitis B, there's multiple things you do when the baby's born. You give the vaccine, but you also give an immunoglobulin. And the combination of that greatly, greatly reduces the risk that the baby will then contract hepatitis B. And you continue to follow them and kind of check again at periodic. I think it's about, could be 6 months a year. I'm not sure the exact times, but you check at specific intervals to make sure that the baby did not get hepatitis B from birth. And
So definitely then by vaccinating early, you have a markedly less chance of seroconverting if you haven't yet. So the vaccine, so to me, that's like mandatory, you know, especially if somebody has hepatitis or had hepatitis. Um, now in hepatitis C, obviously there's no vaccine yet, but if a kid, because I was curious about this, if a baby has hepatitis C, are any of the drugs, since it's curable now, it's treatable, and we can, like with Epclusa and things like that. Do you treat kids who are born, whose mothers have hepatitis C and give it to the baby, or do you wait a certain time period?
that I actually am not sure of. I have luckily not come across that. But
Okay.
that would be a very good question for pediatric infectious diseases and
Right.
hepatology.
Right. I mean, I'm sure at Children's they see it in private practice, but it's the same thing with HIV. There's a lot of people walking around with it, who it hasn't manifested itself.
Mhm.
So,
And then
um,
I had one
you
more
know,
thing to say about it, actually, Michael, for the hepatitis B. So there's the vertical transmission from the mom for
mhm,
infants. And then the other part of it, too, is in the beginning, it's largely what we call a silent disease. Someone can have the hepatitis B virus for a long time until they realize, until they show any symptoms, until they happen to test for it. And so people can be walking around and not knowing that they have the virus. And so that leaves an unvaccinated infant at risk. And there are other ways, like, yes, primarily people are getting it from sexually transmitted, from contaminated,
mhm,
things like that. But say a friend, a family member comes over, has hepatitis B, doesn't know they have it, has kind of like an open sore, something like that, and they're kissing the baby, there's a chance they could get it.
right. I mean, to me, it's the same thing because, I mean, there's data to show that, herpes, I'm talking about, herpes 1 and 2, um, not herpes zoster.
Yep.
Um, but people are asymptomatic carriers and have
Mhm.
never known that they've had it. So, that's what I'm saying. So it's kind of the same thing as hepatitis B. Like there are plenty of people who are walking around and, I saw it in my residency, like I remember a 19-year-old girl had suddenly a huge hepatoma, liver cancer.
Mhm.
And despite operating on her, I mean, she died and she had no idea. She wasn't an IV drug abuser, clearly it was, you know, um, from, sexually transmitted, but she was asymptomatic until she wasn't. So, um, obviously there's no vaccine against herpes, but if there was that, that's be a great vaccine for obviously for kids,
Yeah.
and I'm sure they'd be given that right away. Um, the other thing that I want you to talk about um, is HPV, and I want you to stress how
Mhm.
important, because 70% of oral pharyngeal cancers, so mouth, tongue, throat, is HPV. Nearly 100% of cervical cancers are HPV. Um, and anal cancers, I think it's like 60 or something. And the HPV vaccine, if you give it when you're supposed to, it pretty much prevents those cancers. There's not, so I'm sure you feel strongly, like, right? I mean,
Oh, yes.
HPV is like mandatory.
It is such a crucial vaccine, and the rates of cervical cancer have come down so much since it came out. Let's see, that vaccine came out back when I was a teenager, and it's even better now than it used to be. It covered,
Hmm.
I think it was 4 or 5 strains, and now it's 9 strains of the virus, and so
Hmm.
such an important thing. And the big thing is getting it to children before they become sexually active
Right.
and have the chance of transmitting it. And so this is a vaccine that prevents cancer. Like this.
Right. And I always tell people, I'm like, short of skin cancer, basal cells and squamous cells, because a lot of melanomas are not from the sun, they're usually worse. But pretty much other than skin cancers, the only cancer that is really like preventable is cervical. The odds are pretty high with oral pharyngeal, that it's HPV related. I mean, actually, excuse me, the numbers I think are 90% now that I think about it of oral pharyngeal cancers are HPV. Short of that, can you think of any other cancers that are preventable? I can't. We pick them up early. Hopefully you're picking them up early. It's not prevention, it's screening and picking it up early, so maybe they'll survive. But I mean, this is one of the few cancers that we can prevent.
Exactly. And because also so many cancers have so many causes. Cervical
Right,
cancer is from HPV. Like we
right,
know the cause. It is this virus causes this cancer. And so having a vaccine for it to prevent it is so important. And it
right.
was one of the biggest things that has happened in public health in the last 20 years.
I mean, to me, it's monumental. But I hear from friends who have kids, well, my kids are not going to be sexually active. I'm sure you see that. Like, they're not going to be sexually active. I've taught them right from wrong, and they're not going to do this. And I look at them, and you know how I am, like my personality. I'm really blunt, and I'm like, okay, like you can only imagine what I say. But kids are having sex at 10 years old. Okay, like
That does happen. On the whole, most 10-year-olds aren't yet. But that's why the recommendation for the vaccine is to try to catch it at an age range before most of
right. I think it's 9 to 11,
9
right?
to 11. Exactly.
And I think you can give it up to 46 years old, but it's not recommended unless you're like in a high risk
Yeah.
profession, like a healthcare worker. But yeah, I mean, I just feel, really strongly about that because, it's preventable. So, what else, do you think is important? The one thing that I wanted to talk about, just transition, is I want, as you know, we use and people use the emergency room as their primary care. And
Yeah.
now that, especially that this bill passed, it's I don't know, it's gonna, as rural hospitals are closing, people are gonna have to travel long distances, but ERs are gonna become overwhelmed. So when does a parent, just because your kid has a fever, who needs to go to an emergency room or an urgent care? First question, and then you can talk about specific. Do you think every kid under 2 months of age who's sick or has a fever, should they go? I mean, is that like a good age cutoff? Like if you're
Yeah.
below two
So
months?
not necessarily sick. Like if they have like a slight cold and they're
Right.
feeling well and they're not having trouble breathing, that doesn't warrant an ER visit. But fever under 2 months does, and there's a reason why. So There is a lot of concern about fever in kind of general population, but something that we see all the time in pediatrics. And so a kid gets a fever, and parents very quickly get worried. They call us, they see a high fever, like 104, and they rush them to the hospital. And oftentimes it's not necessary, because fever itself isn't dangerous. Fever is the immune system's response to whatever is going on. And it's usually being sick with the virus. Prior to 2 months old, the reason that we care is infants under 2 months old are just at much higher risk of, when they get sick, that it's something more severe, like a severe bacterial infection. So a
Right.
blood infection, meningitis, so brain infection, or urinary tract infection. And so when infants under 2 months get a fever, there's a much higher chance that is something serious. And so infants under 2 months, if they get a fever, and fever technically is 100.4 or higher.
Right.
So a temperature of 99, that's actually just a normal temperature
Right.
still.
I mean, I always say 100.8, but that's more in
Yeah,
adults.
so 100.4 is the cutoff that we use. But so infants under 2 months that have a fever, and we actually, the way you take it is important too. So we always recommend doing a rectal temperature. They do require a visit to the ER, and they need to be checked to make sure that there isn't a serious bacterial infection going
Right.
on.
And then what about if you have a kid who's 2 years of age, because
Mhm.
I want parents to listen to this, or people, if you have a kid who's 2 months of age, has a
Two
little
months,
cough,
2 months or
I
two
mean,
years?
2 years of age, who has a little cough, who has a fever, let's say maybe to 101, but who's eating and drinking. They do not need to go to the emergency room right then and there. The parents do not need to freak out and panic, correct?
Not for the fever of 101. So it's what I always tell parents, it's not the number, it's not the fever, it's the child. So you're not treating a number, you're treating your
Right.
child. And so the number itself, it doesn't matter. So like, kids have really robust immune responses. They spike high fevers. They will get to 104, 105. If one of us hit a fever that high, we would be very ill, because adults just don't do that often, but
Right.
kids do. And so I think there's that little bit of discrepancy there. And yes, with a high fever, a kid's generally not going to look great, because they're going to feel horrible. And there's a lot of immune responses to fever that will make them look worse. So when you have a high fever, or just even a mid-range fever, you are going to be expending more energy. You are greater chance for dehydration. Your heart beats faster. You breathe faster. So you don't look as good as you do normally. So what I always tell parents, treat the fever, bring it down, see how your kid's doing. And oftentimes they look like their normal self again. And so it's the overall picture. So a kid could have a temperature of 99.5, but be struggling to breathe, not eating, getting dehydrated. That's a kid you want to bring into the
Right.
hospital.
Right.
But not a kid that has a fever of 102 who is eating and drinking and running around.
Right. Or fine, they're not eating, but they're taking Pedialyte, or they're drinking
Mhm.
fine. They
Yeah.
don't, I mean, it's the same thing. Okay, good. So is there anything that you think we need to touch on, or that you specifically want to talk about more? Because I think this was great. Like, I'm I never thought I would talk to a pediatrician. Um, because my experience is just operating on kids,
Right.
and you guys can take care of them. I mean, the smallest baby that I operated on at University of Miami I did a PDA ligation. My chairman let me do it in an 800-gram baby,
That's
in the NICU. I mean, that's insane, right?
that is
I
very
mean,
insane. Yeah.
that's like smaller than a rotisserie chicken from Walmart, and it's when we take off the loops, you're looking at the kid and you're like, I just did that, like
Mm-hmm.
the kid's this big. So, is there anything that we need to touch on that you feel like we haven't touched on?
No, I think we we've been pretty comprehensive. But the one thing that I just always like to mention about kids is, and it's one thing that I also love about pediatrics, is kids are really resilient. And
Right.
so the vast majority of time, things are okay. They get sick all the time. Kids are
Hmm.
constantly sick, especially once they go to daycare, they go to school. They are sick constantly, but most of the time they are okay. And so if there's ever any question about that, you should always reach out to your pediatrician and make sure and kind of go over those warning signs that warrant getting checked out or in further levels of care. But most of the time, things are going to be okay.
Well, you're gonna laugh, but I always thought about this. Since you guys are always seeing sick kids, do pediatricians as a group develop immunity? Like, because I would imagine if you're seeing sick kids with infectious viruses where, their whole school, aren't you guys getting sick a lot or no? I mean, what really is the truth?
I mean, it depends. I would say that earlier on, I got sick more than I get now. I think, I mean, I put a mask on when I go into a sick visit just to kind of give myself
Okay.
extra protection. I
Okay.
don't get sick all that often, but I feel like I could not really feel sick at all, maybe have a slight sniffle, and then my husband gets very ill. So
Okay.
I think that I get a lot
Right.
of
Right.
exposure, which helps.
Okay. So with that, I'm excited. I want to have you on again. And I definitely any of your friends who are specialists in pediatrics, because um people think that kids are little adults and they're not,
Yeah,
at all.
no.
And that's why we have pediatric cardiologists and pediatric
Mhm.
gastroenterology and infectious disease. But with that, I want to thank everybody for listening. So Lauren, do you want to share anything, any of your social media accounts, and so we can post them and people can find you?
Yeah, yeah. So I have an Instagram account that people can follow. It's Dr. Lauren Peds, where I kind of put latest up to date kind of
LAURENPEDS.
yes. No, so yeah, Dr. Lauren. So Dr. Lauren Peds.
Okay. Um, Obviously, you can find me at Paladin MDs, www.paladin, PALADINMDS.com. And you can watch the podcast. We're on YouTube and Spotify and Apple Podcasts, and we'll be posting those addresses. And thank you so much for doing the show with me today. It was a pleasure.
It was a pleasure for you as well. Thank you, Michael.
Okay, Lauren.